So a lot of stuff that I've been running into for problems in my shoulder, knee, and elbow have been stuff that I've had for a long time that come and go, and they make me stop from working out, but I figured out ways to work around them. And hopefully some of the stuff that I share with you in this video will help you. You can go ahead and skip to the area where you feel that you have a problem, and it might be similar to what the problem that you're having. So go ahead and just skip ahead. Thanks for watching. So I wanted to do a video on my full body routine, just kind of go over some of the things that have been working for me and some of the things that have not. I should really say everything's been working pretty good. The only problem is dealing with joint dysfunction. A lot of the stuff I learned to mitigate injury and problems come from my background as a personal trainer for the last 12 years. Also working with clients with injuries, doing a lot of research on my own. I'm also I have a back problem or a hip problem here in my psoas and my hip flexor complex. And it kind of leads to a lot of problems that makes it difficult for me to get work done or to work out. It actually makes me afraid to work out. But because I've been diligent at kind of learning lots of different things, probably one of the biggest influences on my injury prevention and kind of training regimen have been Kelly Starrett of the Mobility WOD. He has a lot of great information. I recommend you check his stuff out. No, Ellie. It's my daughter here. I recommend that you check his stuff out. There's a lot of good stuff. But I want to show you what's been working for me. I've been 4 weeks on this program. I was able to PR a 485-pound sumo deadlift. I also have been able to work out some shortcomings in my squat. Because the trouble I've been having in my squat is lower back strength. Because, you know, having to maintain an upright position. And if you have really strong lower back, you can mitigate some bad mechanics in the hips. Because if your hamstrings and glutes are tight, or your hamstrings and adductors are tight, I should say, it makes you pitch forward a ton. And obviously your lower back is going to take a blunt of the force. So having an upright body is really important to squat well. And I was able to do a 300-pound squat for 8 reps, 2 sets. And I was able to do a 315-pound squat for 5 reps. And it's working great. But I do want to go over some of my injuries. So the things that I've been getting that have been affecting my problems have been, first thing, my elbow. If you've seen, I've had some videos on the elbow pain, particularly my left elbow on the outer side, lateral epicondyle. And then we have the medial epicondyle, which is right here, or medial epicondyle is here, but then I'm having pain in the medial epicondyle of my right elbow, and then pain on the lateral epicondyle of my left elbow. And a lot of this usually comes from squats. Because of having to press the bar on my back, which causes a lot of this kind of valgus elbow force in the elbow. And then for the left side, you know, I'm not quite 100% sure what's causing this issue. I think this is my stronger gripping side, like when sorry about that. This is my stronger gripping side. And because it is my stronger gripping side, since it's my stronger gripping side, I think it just works really hard, especially when I deadlift, high volumes, heavy weight. And I think overall it just kind of catches up with me. And things to mitigate them, sometimes I can't even, like after I squat, it's hard for me to bench press. So I use a voodoo floss band and just wrap this bad boy around pretty tight. And I do a few warm-up sets. I do both sides usually. And then what will end up happening is it goes away. A lot of it, and then also another thing I have to do kind of in the middle of the day or at night is I have to foam roll the affected area. And typically what happens is when you have elbow pain or you have knee pain or usually any kind of pain, you need to look at where the insertions and origins are and you need to usually create flexibility or mobility in those areas. So typically in the elbow, you got your forearm muscle here, you got the tricep and the bicep. For me, this tricep here is freaking tender as hell. It's very tight, it's very stiff, and when I roll it out, I almost want to cry. It freaking hurts. So having to be able to roll this out makes a big difference in creating a lot of tension here in this lateral epicondyle. And then for the medial epicondyle here, I find that it just has a lot to do with just not having good shoulder flexibility. Because when I have the bar on my back and I'm pressing against my shoulder blades, what ends up happening is this elbow here has to press in a kind of an awkward angle. It's called valgus elbow force. Yeah. So I'm trying to get rid of that valgus elbow force. So that's what I'm doing. So I'm kind of essentially still rolling the areas out. And if I roll out the forearm and I roll out the bicep, or the bicep, the tricep, it really does reduce the pain, or reduces it significantly. And then of course the whole idea of doing the voodoo floss band, let me go grab one. It really does help because what it does, it distributes the tension. So to help you understand a little bit kind of what causes some elbow pain, Now it's not super tight, but what it does, it helps distribute the tension, because a lot of time when there's pain here or here, there's over tension where the tendon is, or it attaches to the bone. And when you press this band here, it kind of distributes the tension a little bit better. So instead of having so much tension in this section, it'll help distribute the tension better and reduce the tension here. Okay, so now knee pain, I want to go over that. That is kind of annoying because there's really several different kinds of knee pain, or what causes knee pain. It's either dysfunction or overuse. Those are the two most common, but usually dysfunction will lead to overuse. So for me, after I did that PR at 485, I had some knee pain when I was doing yoga at 10 o'clock. So I did PR, like I think I did that deadlift around 8 o'clock, and I was doing some stretches, and I'm getting some medial knee pain. So medial means the inside of the knee right here. And what happens is, I was getting some soreness. It hurt to fully flex it. If I tried to do a full extension of the knee, just kind of a mild pain. So what I did to mitigate that is, you got a lot of muscles here in the adductors, and this is a big problem area for me and a lot of people, is that their inner thigh gets very, very stiff and very, very tight. And when it gets very tight, it will make the knee move weird. So now I'm having pain here in this left knee, and it's actually where most of my pain comes from. I get a kind of like a little quadricep tendonitis overuse, and most likely has a lot to do with not having enough strength in the hamstrings or proper function in the hamstrings, causing my quads to overuse. That's just one of the theories anyway of imbalance. There's a lot of different things. You know, if you have any kind of pain, usually your body can work through it if you know how to nurse it and you know how to kind of push through in an appropriate way. So simply just rolling this set area out with a foam roller will make a big difference. And then also the muscles of the calves. The muscles of the calves also is another problem too, because the muscles of the calves are what actually make it so that your knee doesn't move properly. Actually, everything is important, but when your knee is not able, when your calves are very tight, because when you squat, your knees are supposed to go out like this, okay? You want to have this knees out position, and that way, so that a lot of times people who have tight ankles or tight calves, they can't get this external rotation force. And what happens is you'll dump like this. And this dumping of the knee is what actually will cause a lot of pressure in here. So when I go into a full squat, you can see this, my heel's coming off, but I go into a full squat, sometimes you'll get some knee adducting in and coming in. And that's what actually will kind of cause overtension in the system over into that area of your knee. Really breaking up the tension in your calves is also really, really important. More specifically, when you can't create that kind of that knees out position, you need to work on the side of your calves here, rolling it out, massaging it, or get a massage, my shoulder. So benching 5 days a week have been actually pretty phenomenal. My gains have been great. I can't believe how light 225 pounds is. Man, that stuff is just like, it just floats off. It floats off. I can hammer out 10 like it's nothing. Before, it used to weigh a ton. And I think a lot of it is just practice. I'm getting better at the movement pattern. Even though I've been benching for years, I bench like once a week, or maybe once every 10 days, or maybe twice a week sometimes. Or sometimes I've done 3 days a week. What I found is that benching 3 days a week too hard is bad. If I bench really hard maybe 2 days, and then light 3 days, I seem to do a lot better. But one of the things that happens to a lot of people with the shoulder is they get into the shoulder position, and then they press, and their shoulder protracts. It loses position, it loses this external rotation torque that's actually in the book that Kelly Starrett wrote, The Supple Leopard. And a lot of stuff that he talks about is creating this really good external rotation torque to keep the shoulder in position while you're pressing. And when this shoulder moves too much, that's actually what causes problems, or leads to problems, when you have instability in the shoulder. I'm having a lot of tension, like I'm having trouble externally rotating like this. Or actually I'm not having trouble, it's tight, it's stiff, it hurts like a very small amount. Like I have to find that spot, like right there. That hurts. And a lot of it has to do, there's probably a little bit of inflammation. My rotator cuff is probably inflamed because my volume of training is pretty high. So what I have to do is I need to foam roll this. I actually use a softball. So I have a softball here, and what I do is I just press on the shoulder, and you just press, and then you just kind of roll, and as you roll, you move your arm. Now you move your arm like this because you're trying to create this internal rotation. You're just pressing really hard in that area. Lo and behold, the pain is gone. Why is that? Who knows? what happens is you're decreasing tension in the system where there's bad motor pattern, bad movement, things getting in the way of things. And now that I'm able to kind of get this arm to go back and it doesn't hurt anymore, like I can't find that pain spot. I did too many reps on the bench. I basically trained to near failure on yesterday, which I shouldn't have, but... So there's this one which I showed in the previous video, like this, where you pull, stretch this subscapularis, and then I contract, pull against, then relax, contract, relax. This side's tighter than my left. So then now I can have all this range of motion. Like, wow, doesn't hurt anymore. Because the shoulder, or the humerus, the upper arm, is able to move around more freely and not run into things.